Let me just ask one question. We'll try to keep it brief within our time frame. Jim, is there a U.S. city that you think really reflects a smart approach to active design?
Luckily, there's a lot of cities doing great things. I'll mention a couple. One is, I think a fantastic example is New York City. They have done very transformative, very bold things. Portland, Oregon has been working on this a long time. And in my home state of Mississippi, Chip Johnson in Hernando, Mississippi, has become a national leader. Just based on what he's done with his little town. He's decided, I'm the health mayor, and I'm gonna change my town so it's healthier. And just one other thing, my hometown of Jackson, Mississippi, I went to it a few months ago, and I was shocked to find that they have the main street, the classic main street going up to the old Capitol building, torn up, and they are widening the sidewalks, narrowing the street, and putting roundabouts so it's more pedestrian friendly. So from New York to Jackson, Mississippi, I think there's a lot in between that can do the same.
Excellent, great, thank you. Any comments coming up? Yes, please. Name and organization, quickly.
Hi, I'm Joni Eisenberg with the DC Department of Health. And I'm very excited about what both Jim and Abby said. I have a million questions, but I'll ask one. Harnessing social change. Jim, I know you didn't focus on that in your presentation, but I wonder if you could mention that, and particularly with regards to what Tony Yancey was doing with Instant Recess, harnessing social change. And I wonder if Abby, because you just sped through that section, Abby, if you could give some examples where communities or cities are actually harnessing social change to promote physical activity.
Okay.
Because I'll just say that often in health departments we talk so much about policy, and we don't talk about community engagement and harnessing the change of large numbers of people.
Well, you see the legacy of Tony Yancey, our unfortunately dearly departed colleague who was a big part of earlier IOM groups. She started this idea of instant recess where you can change physical activity, change the world 10 minutes at a time, and we're doing that here in this meeting. So that has become a social change that we hope you take home to your meetings. So the same thing with active applause. We want this to become a social movement, standing up in meetings like this one. So I think there are examples, and we certainly give honor to Tony for starting that.
You know, I think there are hundreds, if not thousands, of natural experiments going on all across the U.S. from the bottom up, grassroots things that are going on in virtually every community. I think as researchers and policy people, we don't have a great way to harness those, but we see all kinds of community-based, organizational-based things happening just in my own area of the Bay Area and everywhere where I've lived. So I think a lot of it is for us to pay attention to what's going on in our own environments. I read the paper every morning to see what kind of things are going on policy-wise or other things, and I think we can actually use those as natural experiments, collect and evaluate them, and get them out.
We've got about 5 more minutes, and I'm sure that Abby and Jim will be available once we have our hard stop at the bottom of the hour on this session, but please.
Hi, I'm Dan Hadfield from Child Obesity 180 at Tufts. And thank you for this great presentation. I found it interesting that a lot of the research looking at technology was actually focused on older users. And I'm interested in your thoughts on some of the unique challenges in working with children. And I think sort of counterintuitively, children may be more difficult to engage just given the competition that you face in terms of their access to technology. And I think that's feeding a lot of interest in things like gamification and incorporation of incentives. But for me, that raises some questions about long-term behavior change and are we fostering intrinsic motivation? I'm just wondering if you could talk a bit about some of those challenges and what you think we need to continue to learn from a research perspective.
Yeah, I mean, that is a great question. For kids, it's so natural for them. I mean, I haven't been on an airplane where every child is playing with something on the plane. So it's really part of their DNA now, which is almost bad. And I think your point is right on in terms of there's so much of this stuff. In a way, the goal is sometimes to unplug them so they look up and actually look in their environments. So I think we're going to have to do some stealth approaches, really to harness things the way Dance Revolution and some of these games have harnessed play and really made it play and not made it a health thing. So I think that's one thing. I think the other thing is that kids can lead the way for other generations, and I think we should really have them be the leaders in helping other generations use these technologies for good around physical activity and healthy living.
Two more quick questions and quick responses, please.
Abby, this question's for you, given what you focused on. Can you talk a little bit about, and this is Eduardo Sanchez, I'm on the round table, talk a little bit about engaging that part of the community, the IT community and the venture capital community, and how we put some bounds around where this can go.
Yeah, that is such an important question, Eduardo. And actually, Silicon Valley is more ripe than ever for health-related technologies. It sort of happened 10 years ago. People got discouraged about it. They've now come back to the table, and they are knocking on the doors of researchers all around the country to partner, because I think they really get, for the first time, the synergies between making sense of these data, which is going to help their profit margins, but also do good in the world. I think more and more private sectors want to do good in the world, and we can partner and help them with that.
Okay. Quickly, please.
Frank Perna, NCI. Jim and Abby, wonderful presentations. I had a question that was, Jamie and Amy spoke about kind of threshold effects in terms of how stringent policy had to be before you would see a change. In the same way, if we're unrolling individually targeted interventions, do you have a sense of, is there a threshold environment, kind of using the mini maps approach? Like, how good does the environment have to be before you would expect interventions?
Well, you had that nice linear relationship, right?
Yes. So from just the point of view of designing environments for active living, the more the better. All right. So I think the more effort and thought we put into making it an outstanding place, a great place for physical activity, the better it's going to be. But I think part of your question was about the marriage of these two ideas. And you know, how much might an activity-friendly environment help people with help people with these with Carmen? You know, and is it going to be easier for them to take Carmen's advice, you know, if they live in a place with sidewalks? And I think that's still a research question. There have been a couple of studies on that, but not nearly enough for us to understand what's going on.
For their compellingly dangerous insights and ideas, let's give Abby and Jim actors.